Welcome back to my YouTube channel, guys. Welcome back to our YouTube channel.
Welcome back.
How have you guys been?
Good, okay.
I took my vaccine and it has been a rough couple of days.
Yeah.
But I'm alive and I'm well and I have no flu or nothing. It's just been headaches and just a general sick feeling. But, you know, it's fine. I don't know what's wrong. Which has been self-prescribed. And your girl was on her ish.
Guys, welcome back to my channel. I have a special guest with me today. It is Alisha Lewis, also known as Nurse Lewis. So today I'll be asking her a few questions just to give an update as to her nursing career. She currently works at the maternity ward.
Obstetrics now.
Well, obstetrics, correction. So let's begin. The first thing I would like to know is how has the transition been?
Okay, so how has the transition been? Honestly, it's just, I feel as if as students we were so much into the whole practical part of it, like towards the end. It came kind of naturally, except for that year that we had off. But it came naturally, kind of like riding a bike, as they say. So yeah, I think the only thing I had to come to terms with per se was not having anybody to fall back on.
True.
It's just, well, it's not just me. I have my co-workers and stuff, but decision wise there are a lot of things that I would have to, like, maybe if I do an assessment on a patient, I would have to decide, like, you know, does this warrant telling the doctor or not? Like, is there something that I could do as the nurse to, you know? But yeah, it has been easy so far. It's not, let's say, too far in, so I don't have much to say yet.
Okay. Well, for me, as I said in my previous video, it was a little hectic trying to adapt.
Well, they're babying me where I'm at. So,
Okay.
you know.
There are some
Baby,
very nice
baby,
nurses.
but,
Shout
yeah.
out to them.
They're
Very nice
teaching
nurses.
me, like they're really teaching me
Yeah.
and helping me. If I don't know something and I have a question, I could just ask, however stupid I think it is, and they would help. They would repeat things over and over again until I get it, and that's really, I really appreciate that.
Yeah. It's not the same everywhere. There is this saying that nurses eat the young.
Mm-hmm.
I haven't experienced that personally.
Yeah, I think
so. You know, you just go wherever you are headed with an open mindset. You know. But yeah. Question number 2. So Nurse Lewis, where you at currently? Is that where you want to be?
forever and ever and ever, amen.
Lucky her.
No, but you see, when we were doing orientation, they made us fill out a form and put like where we prefer to be. And I think that was, I'm pretty sure that was my first pick, and I'm so happy that I got it, because I put it on a whim, not thinking that they would put an RN in somewhere that's like basically strictly midwifery. And to get to go there, I was like, oh, I feel so blessed. But no, it's, I see that RNs have a lot to do on that ward and not just, you know, medication.
Yeah.
We could do any other thing except deliveries, which is really good. So I'm learning to do everything.
Personally, I don't like that word.
I love it.
I mean, if I get placed there, then I don't have a choice, but it's not my first preference, you know.
I would love it if they keep us where we want to be, and not like, because I feel like the burnout comes when you're somewhere that you don't
Exactly.
love. So you
I don't
force
know.
yourself to go to work every day.
I don't know why we have this thing down here.
Yeah, and I feel like, I don't know if we need to stand up for ourselves and go to sister and be like, sister, look, I don't like it where she's at, and I love it where I'm at, and she hates it where I'm at.
So might as
But
well
she
just
loves
stay,
that she is. So can we just remain where we are for the next 3 months and call that judge?
Well, they have this thing that, you know, nurses supposed to operate efficiently wherever they are put. or placed or whatever.
Yeah, but the question, well, not the question, but the issue is not the effectiveness or efficiency. It's more like, I feel like you should be happy, you should do what you love, and we love nursing, but not everybody loves, let's say, you know, when we went to school and we did informatics, for example, it's like all the different all the different specialities that you could get out of nursing, and everybody fell in love, you could say, with a different one. So why wait? Like me, I don't want to. I would be able to function on med-surg, but I don't want to go to med-surg because I know that that's not where I'll be thriving and happy. I'm loving where I am, and that's where I'm thriving, and that's where I want to like specify. That's where I want to further my education and my career. So why not remain there?
I agree with that 100%. 100%. Of course, I would love to stay in Monge. Since I went there, I've always wanted to be placed there. All my colleagues know that. Since we had our, how do you call it, rotation, I was like, this is definitely where I want to stay. And this is where I'm at now. I'm at Monge, and so far it's going good. I don't know, it's because it's like I had family members who have been there. Anyways, as I was saying, I don't know if it's because I have family members affected, so it's like it's more personal to me, but I enjoy Monday to the full. It's like I don't even want to be placed anywhere else.
It's fun to me. I love it. I like it, but I don't love it as much as I love obstetrics.
So everybody has their preferences, you know. Question number 3. So, Nurse Lewis, do you plan to stay here or do you plan to travel, and why?
Stay here in this country or travel? No, I think one of the, like, just a general issue you have among young people in Grenada is that we don't get enough opportunities to, let's say, to be the best versions of ourselves. So we always have to go and come back, like retire and then come back here and settle and, you know, give whatever else we have left. But I think with what I want to do, I wouldn't be able to do it because I want to do midwifery. And since we started, they said that they're opening the government midwifery program again. But the people that would get first preference wouldn't be the people that would necessarily want to become midwives. It's just that there are people in the system waiting to be in the program because I guess they are owed status, like as a staff, to be a staff nurse instead of just like an RN. So I mean, I guess I understand, but at the same time it doesn't make sense because I feel like if they don't want to do it, if they wouldn't even want to come down to the obstetrics ward and work, why are they getting first preference? Why not give those that actually want to work down there? Because a lot of the wards have short staff. They have the case of being short of staff, and
I think the whole of Grenada know that.
I think that's a worldwide issue, like a pandemic just as much as the COVID is. But I think if they did it in that way, it would make more sense, you know, like foster a community of people that love what they do and not just because let me not go there.
A lot of issues that we don't want to get into.
Yeah.
So what advice you would have for, you know, persons thinking about going into nursing? That's a question. That's a good question.
So it is, because I feel like we had 3 years. You could say like 3.5 because we had to study, and during that time it was. Whew. But anyways, like for the 3 years that we were in school, I would say every one of the 6 semesters I was questioning whether or not I wanted to do what I was doing. I'm like, is it going to be worth it at the end of the 3 years? like I'm killing myself so much now. It is so difficult, like mentally it's a lot, but we did it, so it's doable.
Yeah.
And I think you just have to make your mind up. I mean, it's okay to start thinking that that's what you want, and then halfway through you discover like your passion is not necessarily that, so you switch. That's okay. But I feel like I think I went in a little bit blindly, thinking that, you know, because I'm such a lone wolf, that it would be okay, I'll be fine, and I wouldn't need anybody, because that's me. But like the first semester, fine, you know, you're just getting accustomed to everybody, and we weren't that much up in each other's business then. But the second semester, we had like every class together, and everybody started to know everybody and everybody's business, and then you realize, well, it's not so bad having somebody there to like share the weight with, to understand exactly what you're like doing and what you're, you know,
if
what
you're
the
not a
stress
nursing
is like.
student, you just wouldn't get it.
Yeah. So I think that's one advice that I would definitely give, is just to have somebody maybe from your cohort that really does understand what you're going through, so you could share each other's burdens and you could help each other along. And yeah, like I said, don't be afraid to, let's say, rediscover yourself. Like halfway through you may want to do something else. You may feel as if you need a break. That's okay to take a break if you feel like you need a break, if you can't go anymore. Like if you can't go straight into it. Because I remember there was this one time where we had to go like for an entire year, because we started the August and we went until the July or something.
Oh, yeah, class.
Remember that? Do you remember that? We had a semester, and then we had a winter semester, and we only got Christmas Day, Christmas Eve, Boxing Day, and then the weekend off when we came back to school the Monday. And Christmas was like the Wednesday, so we got like from the Wednesday to the Sunday off, and then we came back to school the Monday. And then we got the 2 days before school started, like to register for the new semester.
Thank God that's over.
Yeah, to register for the new semester. And then we...
So guys, I'm sorry, my memory exceeded, so I had to wipe it off. So we'll continue.
Yes. So as I was saying, yeah. So there are times when it's going to feel like you haven't gotten a break in a year, and that's going to be true, because I feel like everywhere nursing school is, it's a lot. I feel like, because we would have when we did global learning, we had students come down from San Jose University, and we were exchanging experiences, and they had similar experiences to us. It's like, I mean, they had stuff that they had in their curriculum that we kind of envied, and it was vice versa. But I feel like the general consensus was that nursing school is a lot, and you just have to prepare for that. But it is fun, and you make a whole new family, and you may just find like the missing pieces. Like, yeah, it's
shout out to our whole cohort.
Everybody, that was, trust me, it was the perfect size. It was,
even on difficult times, we always find something to laugh about.
It was so fun. It was so fun, and it's like you know that's your family when you could roast somebody.
Yeah.
And then the next day you come back like nothing happened. But it was always the best. And honestly, every day I would sit down sometimes at work, and I'm just like, gosh, I miss this so much.
For real.
And I used to always tell them, like, I would not miss you at all.
Yeah.
And then I was like, I wish I could go back to school.
Not for the schoolwork.
Not for the schoolwork. Sometimes I miss the schoolwork though.
No, I don't.
Just for having something
honestly,
to do.
I don't. I always used to wait. Let me not even say that.
She used to procrastinate. So another piece of advice: don't wait until the last, because what I found happening, which is, they used to always say that I used to get my work done in time, but it's not that. If I sit down to do something, I had to do it in one sitting. I couldn't come and do it over and over until the last year, which I couldn't avoid doing that for the last day. I feel like the last day was so hectic. Sometimes you just have to start something and leave it so that you know it's there, so you have to go back. But in the middle, the workload was a lot because we had pharmacology and pathophysiology, and there was another nursing. I think it was med-surg 2. So it was a lot. And I remember we had adult health. Yeah,
that was a hectic.
That right, not med-surg. And it was so many essays for adult health every time we had an essay. And then we would have small group for pharmacology, we would have something to study for patho, and it was so much. I enjoyed patho class. I didn't enjoy the amount of information that we had to retain, but I enjoyed it. And that's when I learned everything that needed to be learned about diabetes though. Honestly, I understood it very well after patho.
I think we should do a video on diabetes. Maybe diabetes and hypertension, because they're the two most common things.
Yeah. And cancer.
Cancer is
very common in the these days.
It is. But we'll leave that for next video.
Yeah.
So, thank you.
So the tables are being turned. So I'm going to ask you the same questions. I can't remember the first question.
Good. Let's move on to the second.
Well, I'm just going to ask you in any other. But, so, number one, I want to know, do you plan to further, I mean, it's not the same questions, but it's along the same line. Do you plan to further your career, educational-wise, or, you know, in...
So far, I haven't, probably I have to check out UE for psych. But you know, I know how much I love my SGU, and they don't really offer psych. But they offer something I'm interested in, which is business administration. Yeah. Yeah.
I love business.
I love business too. I actually did business in college.
You know, I did business management. And I have business and accounting and everything for CXC.
I think I have all business subjects for CXC.
I got a business certificate from CXC.
Same. Same. So it's either I go to the psych area or I just move up to the MBA area.
It's funny, you know, because I used to entertain the idea of becoming a psychiatric nurse, because I felt like, and not for, you know, those people that we think are taboo with the whole, you know, walking naked in public, not that kind of psych, more like people that have mental issues that we don't really talk about because they're so,
Depression.
it's easy to hide. You know, like anxiety, like social anxiety and that kind of stuff. And I really wanted to go into that part of it, because I know for a fact that I am somewhere on that spectrum. Like OCD, social anxiety, I have piece of a lot of them, and like, I don't know, I feel like a lot of the times you kind of, the way that you deal with yourself, you kind of don't want another person to be dealing with themselves that way. Because you figure if you knew the truth from the beginning, like maybe that was just a mental issue that you were dealing with, maybe you wouldn't be so hard on yourself. So I always wanted to be that person that tells somebody else, hey, it's not you, this is what's going on with you, and this is how you could, you know, help your situation or whatever, deal with it better. And yeah, and I like to talk to people, I like to counsel people, so I figured, why not?
But obstetrics still number one.
Yeah, I love blood and gore and screaming mothers.
Oh, and by the way, as you mentioned, like anxiety, you know, bipolar is something we use loosely. Even I use it all the time, but it's actually a disorder that people don't realize. You know, it's something serious.
Yeah, and it's not exactly how we think it is.
Yeah,
that's one of the things that I had to get in my head, that we would tell somebody, and you're acting bipolar, and that's not really what bipolarism is, and that it's a really like not common, but it's there, and it's serious. Yeah, because the depression that some people would experience from bipolarism, it's not even
the highs and the lows.
Yeah, it must suck.
Today you want to draw out all your money to buy something. Tomorrow it's like you're sunk in depression. Yeah. Suicide thoughts. So yeah.
I think that's one of the things I wanted to do too, to bring awareness to. I think after psychiatric
course.
Yeah, the course, psychiatric nursing. After we did that course, I think a lot of us, well, not a lot of us, but I know Corey, for example. Me and her, we were talking about.
Hi, Corey.
Yeah, we were talking about Dr. What's his name? The one in Mondi. Spencer. Dr. Spencer. He asked us a question, and me and Corey, we had the same response. Something about bringing awareness to like the population, because they make it seem like it's such a taboo thing to talk about mental illness, and in reality it's just like talking about somebody that has cancer or somebody that had a cut, because you don't get, well, not a cut, let's say a sprain, because you don't get to heal from it, but there are ways to treat it that they can live like a normal life. And I think we forget that, like we place them in a box, like that's who they're going to be forever, when honestly they just treated themselves the way that they should have been treated. That's rude. From the get-go, if they had like the right medications and in the right doses, then they would basically be, and you wouldn't even recognize that that's somebody that's supposed to be suffering from mental illness. So
I think you know what, also I think some people don't want to come and take the treatment because of what they think
stigma.
Other people will think.
Because I would think that if I had suffered from mental illness, and as a Grenadian, this wouldn't be something that I would be, I guess now it's easier to make yourself vulnerable to the public. It's sort of a thing now, but I think a lot of people have hidden the fact that they were mentally ill because of the stigma that was attached to it, and I feel like that's not okay. And I don't feel like that's not okay. We know that that's not okay, because then they don't get the right treatment and then they get worse, or they do something that's and they can't take it back.
And the other thing what I hate as well is when people, for example, somebody will be walking naked and you would film it and you would post it on social media and think it's funny. It's not funny. It wouldn't be funny if it was you, exactly, or your family member. It would not be funny at all. So those things are annoying.
There is so much things that we could do instead of picking up a phone and trying to look for clout.
Exactly.
It's not been that long. But so we're hungry. We should probably order stuff for you.
Yeah. We order
pizza and fries.
fries.